All right, so good afternoon, everyone. We are really excited to talk to you today about our data collection plans for our study of the MLP Plus program. Today, we're going to start with a brief overview of these plans, but we'll give you more details and we'll also include these slides in an email follow-up, so you'll have all of this information after our meeting today. Next slide, please.
Give me 1 second. I'm having tech issues.
Thank you. Okay, so I'll begin with a brief overview of our approach that we took to developing these plans. We really began thinking about this before the program started. So we reviewed the literature, we drafted some preliminary questions, we drafted some instruments, but after our awards were made, we really worked to tailor this plan to your program. So we reviewed your applications, we held calls with you to understand your data collection practices, and based on what we've learned, we have now refined those instruments. Where we are right now is that next to last bullet, which you will see is the external review. So we are going to be sending this to some other researchers who work on this topic for their feedback. And then once we have finalized that package, we'll submit it for IRB and OMB review. And we'll certainly keep you updated on those timelines as we go. Next slide, please. Okay, so just an overview of what we're trying to achieve with this study. So this program is brand spanking new for our office. So our evaluation is going to focus on program implementation and participant experiences. So with respect to implementation, we're really interested in learning about the strategies that you're using to expand and strengthen your services. We're really interested in learning how you're integrating those medical, social, and legal services to serve people. And we're interested in the types of barriers that you're facing in implementing it. We're also interested in learning about how participants are experiencing this program. So how are they experiencing the integration of these services? What are their perceived benefits of participation, among other things? Next slide, please. Okay, so this slide, just to preface it, this is an overview slide of some information that we're going to go into in more detail in the following slides. But here, I just want to point out that we've really designed this to reduce, with the hope of reducing the burden of data collection on you as much as possible, while also providing our team with a rich set of data through which we can learn about your programs. So we'll have 3 primary data sources, which I'm going to review briefly here. So first, we're going to have some grant recipient direct reporting. So that's going to be your quarterly narrative PPR. You just fill out one of those. We'll also have a semi-annual quantitative report, which will have more aggregate quantitative data on what you're doing. And again, we'll go over that in more detail soon. We will also do interviews with your staff, so program directors, legal staff, healthcare partners, and social service providers. And then finally, we'll do some focus groups with your clients. Next slide, please. Okay, so for direct reporting, first I want to note that grant recipient direct reporting is used in multiple ways. So first of all, we use it here at the program office to provide you with TA, to better support your programs, and just to really keep track with what you're doing. We on the evaluation team will also use this information to understand, how your programs are progressing and to really accurately be able to document the things that you did and the things that you achieved. So the first part of this is going to be that quarterly narrative report, and you just completed one of those. The lift for that report going forward should not be much more. We will occasionally have different questions that we pose on it, so we can learn about different aspects of your program, but it won't be much more than what you've already done. The second type of report is your semi-annual quantitative report. This is going to be due every 6 months. So we're going to do this in 2 phases. The first 2 reports that you complete, which are going to cover the first 12 months of services, are going to request a smaller number of indicators about individual service delivery. So this is going to be things like the number of individuals receiving intake interviews and the number of individuals receiving MLP services by type of service, the number of cases that you have, the number of matters that you're resolving by type of matter. And we're also interested on this about learning about any partnerships that you've established through the grant or any events that you're hosting through the grant. The third report is going to be a bit more in depth, but we're only asking for that to report on data that or activities that are occurring in the last 6 months of your program. So you'll have plenty of time to set this up and get ready to report on it. So with this final report, or this final 6 months of reporting rather, we're really interested in understanding the flow of clients through your program and how they're being served. So we're going to ask you things like the number of people that were screened by your healthcare partners and referred by them. We'll ask you about the needs that you've identified for them and whether they're being met by social or legal services or some combination of them. We're going to ask you about the type of social service referrals that you're making and the characteristics of program participants. On this form, we are also going to ask about outcomes. Now, we held a bunch of calls with you all, and we learned that you have really diverse ways of capturing outcome information and that you're tracking a diverse number of outcomes. And while our work focuses here primarily on the implementation and of this program and the participant experience, we really want to offer you the opportunity to highlight your achievements. And so we have a number of outcome indicators that we're proposing that you can optionally collect on, but we're also leaving you room to highlight other achievements. So I think that you'll find that that form gives you the opportunity to show everything that you're doing in a way that's meaningful for your programs and the types of people that you're serving and the types of services that you're offering. All right, I'm going to turn it over to Juliana now, who is going to close us out. Thank you.
Thanks, Jessica. So we have two more bullets to sort of flesh out. So first is the interviews of program staff. So we're going to be conducting interviews with program directors and staff who work directly with your patients or clients in the MLP Plus program, and these are going to be 60 to 90-minute interviews. And then, so this is pretty straightforward, and we'll coordinate with you around when we'll do that. These will likely be held in a virtual capacity as well. So hopefully not too heavy of a lift on you and your team. And then next slide, please. And then we also are hoping to do some focus groups. So this will be we're hoping to talk with some folks that have been served directly by you and your staff. And we'll, again, work with you around selecting folks for this. We'll give you an extensive amount of TA to make sure that, we're in partnership around who is joining. We'll have some materials around inviting folks to the focus group. It should take about 90 minutes, and OCS staff will end up conducting those focus groups. So we'll be the ones that will be doing those interviews with your clients. So again, more to come on that, but we're just trying to give you a sense of where we're going moving forward. Yeah, perfect. And then next slide, please. Okay, and then we also just want to give you heads up, Jessica alluded to this, but there will be a final report. So it will include data from all collection activities, and it will be completed at the close of the program. And then this is just a heads up that at OCS, we like to try to develop comms and other materials that really uplift and highlight the work that you're doing. And so throughout the life cycle of this program, there may be times where we come back in and say, hey, we would love to do something like a spotlight video or a one-pager about the work that you're doing. And of course, we'll be in communication with you around those asks, but those are all hopefully in the service of you all as well, so that you can use those materials to talk about your program or to elevate the work that you're doing. Great. Next slide, please. Okay, and then just want to talk about some support that's available to you through this process. So there's always individual level TA. We are all available to you on an individual level. So your broader eval team, me, Jessica, Bronte, Regine. You also have me, Bronte, and Regine as your program specialists. And so you can always reach out to us one-on-one if you want to talk about the evaluation or any support that you need. We're also planning some larger group TA that's going to be a little bit more focused. And we have some ideas around, topics for that we want to explore with you. And then also we want to make these resources, so things like this meeting, we're recording and we're going to be posting, so you can come back and rewatch all of our time together. And so again, I think as we've said throughout this program, we are your partners. We want to be here for you, and we want you to feel really supported through this. So know that as you move through the evaluation, different evaluation components, you're not doing it alone. And we are your partners in this process. So please always reach out to us if there are questions that you have or support that you need. Again, we're interested, especially if we have time today, to hear from you all on some of the larger group TA sessions that we're thinking of. We've heard some common threads in speaking with you all around some things that you're running into. So we want to be able to provide some support back on those things. And then next slide, please. Great. Yeah, so right now you don't really need to do anything else. You just submitted your PPRs, which is great. Thank you for that. And you should be meeting with your program specialist soon to discuss those PPRs. So I think the only other thing that you would have to do now is if you have any immediate questions or concerns about this plan, please come and talk to us. We are here for you, and we want to answer those questions as best we can. Great. And then next slide. Great. And then after this meeting, obviously we're going to share the recording, and then we're also going to share the slide deck so you have the written map of where we're going. So those resources will be available to you. And the recording of the meeting will be posted on the MLP Plus website under there's like a TA section, and we'll redirect you to that when it does get posted. It does take a little bit for us to post things, so we have to move it through a big comms process, but we will get it up. We have to get it posted to YouTube first. So we will get it all sorted though, so you have access to this again. Great. And then next slide. So yeah, that's it. This is that's our overview. So I guess now what we'll do is open it up for any questions that folks might have. We know it's a lot at once, but hopefully that was clear, and we are. I think the only other thing I'll say is if you have a question that you feel is maybe very specific to your program, like we said, all of you are running very different kinds of programs, which is awesome. But if you have a question that is really program specific, I would say maybe hold on it for now, and we're going to try to, either email it to us or give us a call. We can set up a time to meet one-on-one, hoping for more just broad questions to start for this conversation. So yeah, feel free to raise your hand, unmute, put something in the chat.
Hi, I have a question.
Oh.
I may have missed it when you were going through everything. What is the timeline for having the client participation in the interview process? I'm just thinking if we have someone right now that we think is great and you're doing this in a year, that may change their ability to recall or their perceptions of what they recall. So I was wondering if it's going to be rolling or if we're looking more further down the line for that type of participation.
So we are the focus groups are actually going to have to go through the OMB approval or the PRA clearance process. So that will probably be closer to the end of the program. But we will, as we're working through this timeline, we're going to keep you updated on the timeline as we go and when we expect to start reaching out to you and coordinating with you to recruit people for the focus groups.
This is Casey Aldrich with NNCC. Towards that last point that was brought up, I understand that the focus groups have a lot of internal review that they have to go through. Will you also be collecting maybe internal patient feedback, whether that's evaluation scores, success stories that we're collecting, so that we don't lose that input from early program participants?
I love that question. So yes, I think one thing that we want to add to those narrative PPRs is the opportunity for you to give those kind of narrative stories. And we would love it if it were written in a way that we could share it back out. So we really like to uplift our grant recipients and the great work that you're doing. If you look at some of our other programs on our website, I would give you, for example, the Rural Community Development Program, which is another program in OCS. If you poke around in there, we really try to create videos or just short stories or story maps that really show on a community level or an individual level what these programs are doing. So we do want to offer you space to provide that kind of information. And again, on that kind of quantitative form, if there are things that you're collecting that are really meaningful metrics for your program, we're leaving you a space to give that to us and to tell us more about that so that we can tell others about it too. So we're really, at this point, this is new to us, right? And so we're taking a very open kind of exploratory approach because you all are kind of bringing diverse programs to the table. And I think kind of with this open approach, it will allow us to uncover a little bit more about what you're doing than if we tried to structure things up too much up front.
And so this is April Merrill from Oklahoma. In regards to the client interviews, are you thinking that it will be like a group of clients at once? Okay, and about how many are you thinking for that group numbers wise, or do you have an idea?
So we would probably aim for about 6 or 7. I think kind of a smaller group. We have a bit of a longer instrument, so I think we'd want to keep the groups a little bit smaller for that. We are still kind of finessing some budget around that, so I can't give too many details about how many clients or focus groups at this point, but I think we would want to keep them on the smaller side.
Okay, I think that will be helpful. We just have some folks around our state, depending on where they live, that don't have that great of internet access. And I don't want to like make this another barrier, but I could just have them come to my office if that were an issue so they could use our Wi-Fi. And so that might make it a little bit of a different group if they were in person versus via Zoom only.
And I think that's another thing too, when we are organizing focus groups, we want to work with you one-on-one. We recognize that you're working with different populations in different contexts. Some of you are serving, a more compact regional area than others. And so we definitely want to work with you and do it in a way that captures the voices of the people that you're serving without, burdening you too much or them too much. So I think if we work together, we can arrive at something that will give us some really good information to work with.
Yeah, I don't want to be a broken record, but the email access, just general accessibility, is also a Montana issue where we're pretty dispersed. And we've also found where we've tried to do some other client feedback or focus groups, it's really hard for our clients to take time out to do this. So if there's a way to provide some incentives or support or some other thing that does not add additional burdens in their life, it's a real concern that they can't take time off work, they don't have childcare, what have you. So
absolutely,
I would hope that
yes, understood.
in.
Yeah, we are, and that's part of our budget that we're looking at too. Is can we provide enough of an incentive for participants to make it make it something that is actually doable for them. And I do want to note we likely won't do focus groups with every site. So if it just so happens that it's really difficult to do at your site, we can work around that and find ways. Again, we're trying to be very open to different ways to report on your achievements.
I really appreciate you guys taking the time to sit down and explain and walk us through this process. This has certainly not been my experience of other federal grants that we've had. And so it's really helpful, and it really it just really puts my mind at ease to know we're on the right path and I'm not just totally out in the blue here, because it's sort of like law school, you go in and you're like, I think I'm passing my classes, but I haven't had a grade yet. So your final comes and you're like, where am I? So I really appreciate the feedback and you guys holding these regular meetings with us. I know that certainly not every piece of the federal government does that, but I really appreciate it.
We appreciate you guys too. Your participation in these meetings and giving us that kind of feedback, raising the challenges that we might encounter. I'd hate to plan a focus group and then have no one be able to participate, because we didn't go about it the right way. So we really appreciate your on the ground knowledge and you're willing to share that back up with us.
Aloha, this is Deja from Hawaii. I just wanted to say, not to add again, but I think for us, we do have those same challenges of internet access, et cetera. I think we could get some folks together, but when I'm thinking of a focus group of 6 or 7 people, I think language access would be the hardest challenge for us as far as getting a diverse group of people who probably speak 3 different languages with simultaneous interpretation. So I think for us, a smaller focus group with that in language might be a little bit more doable. So I just wanted to throw that out there. I know that the interpretation challenges and language access will be, for us, I think, one of the harder parts of getting that diverse group together.
That's certainly something we've heard from other sites. And so we are thinking through that. And it's really good to know that ahead of time, that that's something that we should, really consider. But we've talked about that. Actually, April brought that to my attention earlier. And so we've started talking about how we might implement something in another language to ensure that it's inclusive.
And thank you for that. I would this is Dina in Hawaii also. And I would add that it's not impossible and it's super important. So it's something that I think is worth thinking through. And then I also think a lot about our advocates and people who work as interpreters with us, especially at our health center, who would be amazing to interview also, because they're not necessarily the clients, although honestly, a lot of them have been clients of ours also. April, yes, I know. But also that they are such amazing conduits of knowledge for knowing how and when services work. And so I would maybe encourage considering, and maybe we could consider them sort of adjunct staff or something, because we work so much with them, but they also have this knowledge that we don't necessarily have. So just some additional things to think about. Thank you guys so much.
That's really interesting. Are there other sites that maybe have other positions like that that we should consider? We don't have everything finalized yet, so there's still time.
So just to follow up on what Dina was saying, like that's definitely something that we see at our site as well. And in fact, we have a population from Myanmar, and the interpreter I have found actually really helps me with some of the cultural differences. And they're able to sort of help me bridge where I'm like, I'm not understanding, like, am I not communicating well? What's going on here? And they're able to explain like, oh, no, this is just a way of showing deference for your education. Or, like that was the one most recent, there's all kinds of different little barriers that I don't even think of. That oftentimes they'll be like, oh no, you can't shake his hand because you're a female and, that is disrespectful. And I don't even think about it, right? Because I just, hey, nice to meet you. Totally not meaning to be disrespectful, but having those interpreters and that expertise in the cultural competence as well as the language helps a lot.
Just so you know, that is one of the things that we're interested in learning, is about, how you're able to address questions like that in practice as you're working with different groups. So thank you.
I was wondering if you could talk a little bit more about the health outcomes that you might want to collect. Because I know when we met to discuss that as a community-based program, there were a lot of issues around what we could collect. And so I guess I was just wondering if you could talk a little bit more about how that's going to be incorporated into the quarterly reporting process. And have you thought about like universal health outcome measures that you might be most interested in? I know that you mentioned obviously implementation and patient experience or client experience is sort of the primary motivators, but I appreciate that you guys have been really honest about how health outcomes can help demonstrate sort of efficacy of our programs. So anything more there in terms of what that reporting process is going to look like, and if there are some common metrics that you're going to be hoping we can gather?
So again, when we're looking at the outcome data, we're really focusing more, we're kind of allowing more of an optional reporting with that. And the reason is when we spoke to you, some folks are able to work with their health partners, right? And kind of get that data from the health record and track that change over time. Some folks were, able to kind of do that pre and post survey a little bit more easily. And some folks are doing can do that more pre-post social determinants of health outcome work a little bit more easily. And so for us, when we were looking across grant recipients, it was very difficult for us to find something that wasn't going to be incredibly burdensome on somebody. So some of the things, I think we could have found something for each of you, but it was to find something that would really work for everyone and speak as one program that was going to be difficult for us. So right now, again, we're still kind of seeking some external review for our instruments, and that they might add some more stuff. So this is all kind of tentative, but we are, kind of offering space to do some of that, some of those health outcomes. And let me just look real quick, refresh my memory. I know that we do have a question about, or we are considering looking at something about like patient cost recovered, which I think would maybe kind of get at some of that outcome information that might show the potential of this for health partners, right? If you're able to recover those costs. As far as specific, I think another thing that we found is that your sites are all working with very different populations who are dealing with different health challenges. So that's one of the challenges with identifying a common health metric, right? So you might have one site that's focusing on working with, postpartum mothers, like and newborn families, and then another site who is, working with kind of like a more general population, and there might be people that are working more with people who have chronic conditions, and it's difficult to find something across all those sites given all of those different populations. And so we have left some room with our instruments for you to kind of add health outcomes. And I'm trying to see if we had anything that we're drafting. So we were looking at, something like self-reported physical health, decreased stress levels, improved management of chronic conditions. But again, we're kind of opening the door to look at other things as well. And so we're definitely looking forward to collaborating with you. And one benefit of us hosting these regular meetings is that maybe that's something we can surface together.
That's really helpful. Thank you.
No, I liked the telehealth monitor thing. Harvard Health Healthcare.
Hey, Aileen, I think you might
So
be
it
off.
was like an iPad, and
Hold on. Okay, got it.
You can go. Hey, I'm Haley Greenwell. I'm with Memphis Child, the medical legal partnership of Le Bonheur Children's Hospital in Memphis, Tennessee. And I know we talked about, and we just mentioned some self-assessment, client-reported data. We do a survey for our clients to determine what was the effectiveness of the MLP intervention at the end of our case. And when I met with Bronte, which is our project officer, about if there were any further questions that y'all wanted us to implement into that survey, the answer was undetermined at that time. Have y'all learned if there's any particular, I heard a few things you mentioned, Jessica, like of what you're looking for, but I personally haven't received that in any sort of communication from you all. So I'm wondering if you all have specific questions, or again, like those outcomes. I know you're looking on a broad more scale, but specifically as it relates to the survey.
So I think when we get this to the point where we, post it in the Federal Register notice, we can share it with you guys and request your feedback on it. So that is one thing that we're going to be asking for, is we'd like to hear what you have to say about it before we implement it. And then at that time, I think you'll have a better idea, but you'll also have the opportunity to engage with a conversation with us about how it should look. That will be soon. Sorry, as far as timeline. We hope to submit it, in the next couple of weeks, I think. So.
Okay, excellent. Thank you so much.
Are there any other questions? And you feel free to email us too.
Yeah.
You know, we're happy to talk about any individual questions you have for your program. And again, we'll be keeping you updated as we go through this process, and we really value your feedback. We're partners in this, and we're really hoping that we can learn a lot together.
Okay, great. So if there, and again, if you think of other questions as we move through this time, then please feel free to raise your hand or drop them in the chat. I think we'll only take another couple minutes, but we just wanted to sort of introduce a couple of ideas or thoughts around TA topics and get your feedback on what would be useful to you in this space. So I think I can start by just reflecting back a couple of things that we've heard in talking with you all, and then I will just open up the floor again if there are other topics that would be useful for this group. And so I think one common thread that we're hearing is some challenges around hiring legal staff. So challenges getting lawyers on board for your programs. So that's one thing I'm hearing. And if you all want to say yes or give me a thumbs up, thumbs down, reactions, great. So I'm seeing some thumbs up around that. So that's one topic. I think the other thing we were talking about is just the nature of the relationships that you all have with your healthcare partners, specifically around information sharing, like data sharing, having access sort of to the healthcare partners' systems, and also just generally the way that buy-in works from your healthcare partners, that might be another place for some conversation or for some support from us at the federal level. So and any thoughts, reactions to that, just around collaboration with your healthcare partners? And so just so you know, so we're thinking about a couple of ways that we could potentially, build buy-in for MLPs across the federal space. So we've really thought about specifically working like this is a program that is really built on integration of a couple of fantastic specialties, right? Like combining expertise to serve people better. And so in that spirit, we have thought about the idea of sort of doing a cross federal government panels, inviting some of our colleagues from HRSA, inviting some of our colleagues from CMS potentially, folks that might have some buy-in into the MLP model. And then also maybe having you invite some of your healthcare partners to that conversation and doing a sort of, panel from the federal perspective on what this model brings and, having your healthcare partners listen on that and having a group sort of conversation there. So that's one thought that we have had along that vein of where we can be useful to you having this federal leverage and this federal, program. So that's where we have just from hearing you all and from listening in conversation, those are two buckets of space that we are thinking about trying to provide some support, but want to open up the space right now for any other topics that would be helpful or useful for you where we can provide support. And also if there are any ways in particular that we can be supportive on those topics. We want to be as responsive to you as possible and want to do what makes sense and is actually useful to you. So yeah, feel free to, again, raise your hand, unmute. Happy to hear from you on any other topics.
Hi, it's Haley again. TA, does that just mean technical assistance? Like, what does TA mean?
That's right. Sorry. Yes. Technical assistance. Apologies. Yeah, so we're your technical assistance providers as well. So we are here to, in addition to, managing your grants and making sure that everything is in compliance and also working on this valuation, we're also here to provide support to you as you administer the grant. And that is what we formally call technical assistance, but it's kind of a a big term to just mean we're here to help, right? So yeah.
Hi, this is Dina again. I really like the idea of I like all of these ideas, but I like the idea of the other federal agencies presenting and learning more on our side. And then I love the idea of inviting healthcare partners. I was just thinking about that, like, at what point should I invite some of them? I think if her time was more available, our pediatric partner would just love to come to these, but I know her time is just really tight. And along those lines, I personally would like in the future, I mean, I think the technical assistance stuff is super important for right now, but I really enjoyed the kind of networking thing we did earlier.
Oh, yeah.
Because I think there are probably a lot of unmined topics that we might share across. Like I'm thinking about some of the Social Security work that Deja's been doing a lot of here in Hawaii, and we yeah, and then there's things around education law that we're trying to do more of, but we're very, very new at it right now. So, and also issues around FQHCs versus hospital settings that I think we could probably learn a lot from each other. So I'm not sure quite whether that's just another networking kind of meeting or subgroups or something. So just an idea.
Oh, definitely. Yeah, we plan to continue the networking sort of model. I think obviously today we made it was more of an information sharing meeting. We had some things we wanted to tell you, but we will definitely pivot back to that model in future meetings so you have more space and time. Also, I have found that I did this for another set of meetings, and Zoom is way better for that than the Teams breakout room. So next time we do that, I will make it a Zoom meeting so that I can build the breakout rooms a little bit easier for everybody. So yes, but thank you for raising that, Dina. We will definitely continue iterations of those types of meetings so you have time with each other.
Hi, this is Rachel again from Buffalo, New York.
Hey, Rachel.
Kind of building off something that Dina just said, we were talking internally about if we could meet at one of those breakout sessions and talk about how everyone is capturing like dollar savings to their health partner. I know what we do, but I'm positive we can learn from what other programs are doing too. And then maybe it would be even easier for everyone at ACF to kind of quantify, like, this is what everyone's doing. This is how their tracking of metrics is similar. This is how it's different. But I know that we're leaving cost savings to our partners or dollar benefits to our partners on the table because it's just really hard to quantify that.
Yeah, that's a great. I like that suggestion a lot. Almost like it feels like almost like a working group a little bit, like that you all could come and that it, wouldn't be required by any means, but if it's something that folks are interested in, we could create the space, we could facilitate the space for you all to come and sort of share, or we could designate part of a meeting to that, right? Have the first half be some more informal networking, and then have part of the meeting be designated toward that topic. But I think that's really, I just made a note of that. So I like that idea a lot. And I think that's something we can absolutely facilitate. Awesome. And again, if you don't, if you think of something after this meeting, please, we're always available. Please feel free to email us, reach out. But I think then we will, in our moving forward, probably be organizing the meetings around some of these topics. And we'll try to give you a heads up based on, in our invites, what the meeting will be about and what we're planning on doing. And yeah, I think that is everything that we had for you all today. So are there any final questions or thoughts before we close out the meeting?
Sorry,
I-
there's a comment in the chat that I thought was a good
Oh, yeah.
question
Let's see.
from Casey.
If there are any conferences. Yeah, I think that's a question for the group. Are there any, Casey put, if there are any conferences that folks are already attending that could be used as a meeting of convenience. So I don't know if folks want to unmute or respond in the chat around your conference schedules. I'm sure you all are very busy moving around conferences and things like that.
I know this is Haley again from Memphis. I know that I attended a framework for sustaining your MLP workshop this summer or last summer through the National Center for Medical Legal Partnerships. And they did say that they were bringing back that annual National Center for Medical Legal Partnerships conference. I still haven't seen like the dates come out yet, but I think that should be on all of our radars. But if y'all have another conference, you know, we're so niche that we find that we don't really fit in the healthcare conferences, and we also don't fit in the legal conferences. So if there's anything, our group would love to learn from y'all.
Two conferences that we recently applied for or are going to be for like presenting. The CMS Health Equity Conference, I think that's in late May, which I think could be like really useful. And then also City Match. It's I think it's maternal, I can't remember. It's around like maternal child health. And like community-based organizations. So it might be a little like stretch, but like I think it would be, they're definitely like useful spaces and like places that don't really know much about MLPs and like could really grow that.
Great. Awesome. Any other thoughts or comments? Okay, well, thank you again, everybody, for being with us today. Really appreciate your questions, your engagement, and your partnership in this program. We are very grateful to be walking through this with you all. And like we said in the beginning, you'll get the slide deck after this, and then the recording will come hopefully soon after that. And if you have any questions in the meantime, please feel free to reach out, but we will, our next steps are to really get this moving in OMB, finalize sort of our external reviews, get this moving in OMB. And then, like Jessica said, once it's posted on the Federal Register notice, we can share with you all as well for your reactions and for your input. So, and that process doesn't take too long. So hopefully we'll be able to get you something soon. Great.
And just to add to that, we will be able to make revisions based on your feedback. So
Yes.
Once you see it, it's not final. That's just when it goes to OMB the first time, then we can talk to you, get your feedback, implement, any changes, and then submit it for that final approval. So we look
Great.
forward to hearing from you.
Awesome. All right. Thanks, everyone. I hope you have a wonderful rest of your day, and we'll see you soon.
Thank you.
Thank you.